Hello, everyone. My name is Eldrika Glover Hill, and I will be talking about health literacy. How many times, as a nurse, have you noticed yourself using medical jargon or terms that a patient does not fully comprehend? Being a nurse for over 10 years, I have worked in fast paced environments such as medical surgical units and emergency departments. And we all know sometimes these areas can get really busy where you cannot thoroughly assess the health literacy of your patients. When discharging patients, nurses must take into consideration their health needs and individualized care that the patient requires. According to Bastable, health literacy is the degree to which an individual has the capacity to obtain, communicate, process, and understand basic health information and services to make appropriate health decisions. Health literacy cannot be assessed by simply looking at a person, and it should not be determined by nurses making different stereotypes about patients. In fact, the U.S. Department of Health and Human Services estimates 45% of high school graduates have limited health literacy skills. Health literacy must be fully assessed on all patients to prevent discrepancies in medication instructions, prevention of medication errors, and to decrease morbidity and mortality rates. When choosing a patient for the study, I decided to interview JH, a 72-year-old male who has type 1 diabetes and is post-op recovery from a right great toe amputation. JH has been identified as a person at risk for illiteracy due to multiple factors. He's homeless, he's unemployed, and he also has a poor health status related to a long-standing addiction to cocaine. JH states he's a junior high school dropout. He states he has a ninth grade reading and writing level. So I asked JH who helps him with his care and his medical support since he's homeless. He states he has a sister, OW, who helps him with all of his care, all of his medication, and his doctor's appointments. He says he does not go to his doctor's appointment regularly, and he only seeks care when he gets really sick. JH is distant from any of his children because of his cocaine addiction for over 30 years, which is something he states that he's not very proud of. He voiced he has weak communication skills, and usually he must have someone speak up for him about his medical care. I was saying I was unsure if he's really motivated about learning about his care, because during the interview he stayed unfocused. When I asked about noise and background interference, he states he prefers minimal noise when he's being instructed on something. And he does not mind being seated in a comfortable area. JH has a hard time understanding medical terms such as words like clean and wrap the wound area. He denies any knowledge of computer literacy and states he learns best by other people telling him about his medical instructions and face-to-face encounters with healthcare providers. Since OW assumes care for her brother, she states she has a 10th grade reading and writing level since she dropped out of school as well. She is a certified nursing assistant and has some knowledge on basic care. She understands medical language that refers to cleaning and applying a dressing to the affected area. She states she learns best by verbal instruction from the healthcare team, demonstration, and prefers to have instructions to take home, to read and refer back to have a better understanding of medical care. She does not like noisy backgrounds when being instructed and likes to maintain eye contact and a comfortable sitting position so she can understand everything. OW has agreed to move her brother to her home to provide care for him, administer his medications, wound dressing changes, and be responsible for transporting him to all of his follow-up appointments. She knows that her brother has limited resources, so she has no problem with asking the healthcare team about low-income services that can provide things such as dressing supplies, a bedside commode, and she even asked about wheelchair assistance. OW is fully responsible for reminding her brother to check his blood sugar at least twice a day. Since he's been non-compliant with checking his blood sugar, and it got out of hand, so he developed a wound on basically on his toe. OW is very strongly motivated to see her brother make a full recovery, but she doubts that he will make a full recovery because he has a problem with cocaine addiction. The assessment tool I use for JH literacy in this case is the test of functional health literacy in adults, the TOEFL. It's the form which measures health literacy using hospital materials such as prescription labels and discharge instructions. It takes about 20 minutes to administer, and it tests reading comprehension. JH was instructed to read one of the prescription bottles given to him at the hospital on how to take his medication. I asked him to read the directions to himself, and then I asked him, what does it mean? He stated he takes penicillin every day when the bottle stated to take the medication every 12 hours. I asked if he takes the medication every 12 hours, which is twice a day, and he takes it at 8 a.m., he says, when is the next time he would take the next pill? He stated he would take the medication around evening time when he eats his dinner, which is usually about 5 p.m. I reminded him to take the medication near bedtime so we can get the 12-hour efficacy of the medicine. On the reading comprehension portion of the exam, I asked him to read some instructions, and the areas where words are missing, where you have to fill in the blank, choose from the 4 multiple choice questions that go into the blank. He was unable to fill in comprehension words such as agree to provide information to prove statements. He had a hard time with words like that. He demonstrated an inadequate literacy level with reading and interpreting a prescription bottle instruction, and also when comprehending about applying betadine to his wound area and wrapping the area with gauze wrap. OW, however, demonstrated adequate literacy with questions such as reading a prescription bottle. She was able to say take the medication twice a day. She was able to fill in comprehension words in the TOEFL such as agree to provide information to prove statements, words that will fill in the blank. In conclusion, the learning style for JH can be described by the Dunn and Dunn learning styles. According to Bastable, this model includes motivational factors, social interaction patterns, physiological and environmental elements that affect a person's ability to learn. According to Dunn, emotional and sociological elements play a big part in JH's learning style, since he must have the presence of an authority figure, which he considers his sister, to assist him with learning. He's basically dependent on her for all of his learning. He has trouble staying focused, and his sister basically advocates for all of his care. How OW is motivated to learn, she asks questions about resources available to her brother to help him assist with his recovery. I enjoyed the different learning styles of patient and how to thoroughly assess their learning needs. I think I feel a little bit more confident with the tools in our chapter on how to be successful with assessing our patients. And hopefully I can get better in my career. Thank you.